Hey, what's up, everybody? This is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center. I want to share with you guys a recent case that we did for an all-on-4. We did a surgery within the last 2 weeks, and kind of shows like what our thought process is in regards to like her treatment plan before and after, what other doctors were saying about some options for her, and also how another patient came into my office for a consultation, wanted to know about what her possible treatment options would be. So let's jump right into it. Here's this patient. She came in from Florida. You see it before and after. Some things that we see right off the bat, we have missing teeth. She's not happy about her smile. She's a 57-year-old female. And we have severely worn down teeth, ground down teeth, and also what we call loss, basically her vertical dimension, because she ground down her teeth so far and lost her back teeth. So she had what we call a collapsed bite. So when we go into her x-rays here we have our panoramic x-ray. We do see that we do see the ground down teeth, some big cavities. Basically, to get her fixed up, we would have to restore her back teeth, get some implants back here. The issue that we see on the 3D scan, though, is that she does have, when she lost those teeth many years ago, she lost a lot of bone. And when we talk about dental implants, we're always talking about bone, bone, bone. You need a lot of bone for those dental implants to have a good foundation around the dental implants to make sure that they have a good long-term prognosis. Otherwise, they're going to lose bone over the next few years and then eventually start causing periimplantitis and inflammation and potential worst-case scenario loss of dental implants. So obviously, you don't want that to happen. So in order to prevent that from happening, we need to build up some bone in that area. Okay, so that would be her treatment plan: root canals, crowns, building up the bone with guided bone regeneration, maybe some sinus lifting, dental implants. That treatment plan, we're going to blow her out of the water. We're probably looking at $60,000, $70,000, $80,000. I have no idea, but it would just be an obscene amount of money and just a lot of dental appointments. So basically what she had done is that she actually went into a few other dentists for some treatment options. She told me that she saw a prosthodontist. He looked at her, he recommended full mouth rehab, was going to do a lot of crowns, do all these root canals. Took a look inside her mouth and said, forget that, let's do an all-on-4. She went to somebody else for an all-on-4 option, all-on-4 center. Having been sent down that path, she went to an all-on-4 center. They told her, actually, don't do an all-on-4. Let's do a bunch of crowns in your mouth, which she would need crown lengthening, a lot of crowns, root canals, guided bone regeneration, implants. That's where she was going to get like that $60,000, $80,000 treatment plan. He didn't recommend all-on-4 for her. Kind of makes me wonder why. Then she came and saw us, and I said, honestly, I thought your best recommendation would be to do an all-on-4. So let's basically look at, again, what her before and after was. So this is her, again, before and after. Again, we did this surgery a few weeks ago, and, it's going to be about 5-6 months. We did a digital design on her. And so we did a digital design, and we also did a 3D printed temps, and she's going to wear those temps for a while. Then she's going to be in her final prosthesis later on down the road. But when we look at this treatment plan, like one thing that I like to talk about this case is that there's such a wide assortment of like options that patients can pick from in regards to treatment plans. Do you really want to go down that path of I tell patients, listen, I'm going to give you all your options. You tell me what you want to do. I'm going to tell you about the pros and cons of each, obviously tell you about the money involved. And then I say, I want you to pick your option. The one thing I really want to be upfront with you, again, I've been practicing 11 full years, heading into my 12th year of practice here soon, placed 10,000 implants in my career. I will tell you that if we do go down that path of doing the crowns and the root canals, doing the aesthetic crown lengthening, doing the guided bone regeneration, sinus lifts, implants, you're going to hate me in the end. Not because you paid me more money that way, but because you're going to come in for so many appointments, it's exhausting, right? And so I need to show you guys the case like my dad's mouth in regards to like how many implants I placed on him over 6 years, because he literally had a bunch of ticking time bombs, one tooth after another, just kept on going wrong. Now let me show you another case here. This patient came in for a consultation today. She comes in and this is her smile. She has a really high smile line. She's a 65-year-old female. She had all this work done about 15 years ago. A little hard to see. She lost a tooth here and she lost a tooth here. But she says, hey, my bridge is failing. My tooth here is like wiggling a little loose, and would be like, all right, cool, let's take a look at the x-rays. Oh my God, look at all these dental implants you have in your mouth. You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 implants, had all this crown work, root canals, all that stuff done 15 years ago, and now it's all coming undone, right? And then the other issue when I take a look at her again is the fact that she does have that high smile line. And here it is. Again, what that means is that her lip comes pretty high and I can see all the gums involved, right? So a lot of people, why that gum line really matters is that when we basically take those teeth out that need to come out, let's look at her x-ray again. I mean, she's had all these root canals, she has all these crowns that have gone bad. You know, people think that when it's really easy for dentists to just go in and like remove all these teeth like real easy. And I tell patients, listen, when you've had a crown for that long and it's got decay underneath there, and it's also like, so it gets mushy, right? The tooth literally gets mushy. And then it's been hollowed out too. I tell patients, quick example, if I'm gonna pull a steel pole out from like the soil or from the ground, not too big of a deal. But now let's imagine that that steel pole's been sitting there for 15 years and I try getting it out of the ground. Immediately after I try moving it, then it snaps off because of the rust, right? And then let's say it's embedded in concrete, then I need to remove some of that concrete to get that steel pole out of there intact, right? It's not easy. When I'm doing extractions on patients that have lost their teeth, I mean that have crowns on in their mouth, that the teeth are rotting underneath the crowns, they've also been hollowed out with the root canal, it's very difficult to take those teeth out without messing too much with the bone, right? And so if I mess too much with the surrounding bone, then I'm going to damage that, like that delicate bony architecture that is necessary for the gum lines, like how your gums are peeking between your teeth. That's what we call the papilla. So this is her papilla, how they peek between the teeth. And it's easy to maintain this when you have natural teeth. But when you take those teeth out and you lose the bone, and then even though when we do some bone grafting and how the bone's going to resorb in certain areas between the teeth, it then becomes very difficult when we do these dental implants to maintain those peaks of gum. And so therefore it's not as aesthetic. Let me show you this patient. You could see all the implants that she's had in her mouth. And then let me show you her photos. Here's how she smiles. She has a really low smile line, but as you see, like that really helps mask basically what's going on behind the scenes. Now you see her, like when you look at like when I pull the lips back, what does it really look like, right? So she has a loss of papilla because when she lost all those teeth and had all those implants over time, you know, we had to mask that, having these crowns, having a high contact point. I know this sounds like a foreign language, but this is basically how we can mask some of that bone loss on patients that have a lot of implants. But again, she's in her 60s, she has a low smile line, so on this patient it really doesn't matter. But that's the issue on this patient that I saw today, because she unfortunately has a high smile line. So in order for me to mask that, it's going to be difficult and get these teeth out fully intact, trying to do minimal damage to the bone. So she was asking me, all right, so what are my real treatment options here? And I said, okay, we can take those teeth out and you could do implant bridges, but you have a high smile line. So I worry a little bit about how aesthetic it's going to be compared to what you have right now. So it becomes very delicate in how we handle your bone and gums to make sure you have that the aesthetic result. Because of that, there's going to be more costs involved with how we bone graft it, how we do soft tissue grafting, how delicate we place your dental implants. The other option would be, this sounds like a really bad option, but we can do an all-on-4. And why would we do an all-on-4 on her when she already has those dental implants? And that's why it's a bad option, right? All-on-4 is always, I mean, not always a great option, but the best option. But all-on-4 is probably like one of your top options all the time, right? So as long as you need to get some teeth taken out. But when I look at her case, I don't like the fact that she already has these other implants in here. But if push came to shove, if I needed to remove these implants and place some implants, I could easily do that for her, reduce some bone, do an all-on for her, and just make it look beautiful. You know, all-on-4 prosthesis, not only is the teeth, but it's also the fake gums too. And so that's why, like, even though she has a high smile line, after we do the bone reduction and then we get this inside her mouth, she would have a beautiful smile. With individual implants or implant bridges, it would be very difficult to be able to attain that aesthetic result. Now, it would be less invasive because I wouldn't have to remove the other implants. But when we start adding the costs involved too, because again, it becomes a lot more delicate to do the individual implants or the implant bridges, the costs go up. So that's really kind of like what you have to weigh in regards to like your options. So what is the whole purpose of the video? Going back to again, like that patient and or that we did a few weeks ago that we did her on like her all on four. You saw her before and after, and I also did tell you about the different treatment options that she had. She had a $60,000 to $80,000 treatment option, or she had an all on four option, right? And so she spent a fraction of the money doing the all on four, and she still had a beautiful result. And it's not just about the money. It's also about the number of appointments to, again, do the sinus lifting, guided bone regeneration, crowns, root canals. It's just a lot of work. And I tell people, listen, I always have a great relationship with the patients, but I tell them in all honesty to set expectations. You're going to be sick of coming in all the time for all the, the surgeries and the follow-ups. And it's also going to be over a very long time span too, like tons of visits, right? So what is the option of doing that versus an all on four? And so hopefully this information was a little bit helpful to like help you think in regards to like understand how dentists and different dentists have different opinions in regards to like what your treatment options are and how you can save some time and money with an implant supported option, right? So all on four, snap-on dentures, stuff like that. Not saying that these all-on-four snap-on dentures are always the best option, but just does kind of make you think that maybe there is a quicker and more efficacious way to do things that might be better in the long run too, should I lose some other teeth. So hopefully this information was helpful. If you have any questions, please feel free to leave a comment below. If you thought the video was good, please give me a thumbs up, follow on our channel, and I hope to come up with more good content like this. Thank you.